Hello, this is our pathogen project of Chlamydia and Trichomoniasis by myself, Connor Greer, and Rachna. First, we'll go over chlamydia. Chlamydia is a sexually transmitted bacterial infection, and the typical causative agent of chlamydia is the bacterium called Chlamydia trachomatis. The morphology is gram-negative, obligate intracellular bacteria. They also depend on the host cell for intermediates including ATP. Chlamydia exists in two stages, infectious particles called elementary bodies that are small and rigid, and then intracytoplasmic, which is reproductive forms called reticulate bodies, which are larger and metabolically active. As listed under morphology, also they could be individual or clustered as cocci, and they spread during sexual intercourse or using objects. Moving on to the signs and symptoms of chlamydia, it is oftentimes asymptomatic, which is why it has a nickname of the silent infection, because the majority of people who have it, which is 50 to 70%, never even notice any symptoms. In females, symptoms include smelly white, yellow, or gray discharge, painful intercourse, bleeding in between periods, and itching around the vagina and burning when peeing. And in males, it includes mucus-like or clear watery discharge from the penis and burning sensation when peeing. And the image to the right just explains all of this as well. Treatment includes a single oral dose of azithromycin, which is an antibiotic, and then an alternate regimen includes doxycycline. Prevention is just using condoms during intercourse. If chlamydia is left untreated, females can develop pelvic inflammatory disease, which occurs when the chlamydia damages the reproductive organs, which can lead to infertility and chronic pelvic pain, which leads to the second bullet point, which is pregnancy complications like preterm delivery or passing the infection to the fetus. In males can develop epididymitis, which is an infection spreading to the testicles and the tube that carries sperm to the testicles, causing pain, swelling, tenderness, and reduced fertility. So the epidemiology of chlamydia is that chlamydia is the most common STI caused by bacteria, with 1.5 million cases reported each year. The growth in the cases have steadily increased from 700,000 in the year 2000 to 1.5 million in 2021, which the steady increase is not necessarily due to a true rise in infection rates, but it's largely attributed to expanded screening programs, improved diagnostic techniques, and just greater public awareness about chlamydia. And also, where is it most common? Rates are higher among women, and chlamydia infections disproportionately affect non-Hispanic Black populations. So one case study that I discovered is a case that took place in Thailand, which involved an 11-year-old girl who had symptoms of rhinorrhea, cough, mild fever, and discharge from the eyes. On examination, the chest radiography revealed hyperinflammation, and purullar infiltrates indicate of pneumonia. So testing confirmed chlamydia was the infection, and the treatment consisted of oxygen therapy and a 7-day course of oral azithromycin suspension. And an interesting fact about chlamydia is that it's one of the smallest genomes of all bacteria, consisting of approximately 1.04 million base pairs.